Many different things, such as automobile accidents, ATV accidents, sport-related accidents, falls, assaults, and others can cause a traumatic brain injury. However, wearing seatbelts, helmets, and other proper safety equipment when necessary can decrease your chances or prevent you from suffering a traumatic brain injury. Severity and age are two main factors to consider when determining prognosis. Language development continues throughout life, but the majority of it happens at a young age. So the younger the child is when the accident occurs, the more complications the child may have during development, depending on the severity of the trauma resulting from the accident. The older the child is, the more they have developed, making prognosis better. Once again, it all depends on the severity of the trauma. When a person suffers a traumatic brain injury, they may experience trouble with short-term memory loss, spelling, reading comprehension, problem solving, reading others' emotions, and arithmetic. The interaction between core language skills such as syntax or semantics, the processing demands of the task, and the storage demands of the task all contribute to how individuals with traumatic brain injury will perform. There are some things that teachers can do to help facilitate higher-level language literacy skills in children who have suffered a traumatic brain injury. The main thing teachers can help with is the short-term memory loss. Teachers can do things like having something set up in the classroom with the daily schedule on it, along with providing the child and their parents with a weekly schedule of what they will be doing in class and homework assignments that will be due. A simple map of the school with the child's classrooms marked and routed out can be very beneficial as well. The child can also carry something with their locker number and combination on it, and keeping a class schedule with them that has their classroom number, time, and subject on it can be helpful in keeping these children on task. Another important thing for teachers to keep in mind when they have students who have suffered a traumatic brain injury is allowing them a longer response time when answering questions. Some adolescents are described as having socially inappropriate behavior. Even though these daily behaviors of these individuals may be similar, the causes may be different. Some may recognize social cues, but are unable to regulate their behavior accordingly, while others may not consistently recognize social cues. Meaning some may need strategies for detecting social cues, while others may need strategies for self-monitoring. Most errors in conversational skills are related to the detection of sarcasm and bragging and the feelings it evokes in the listener. Children with traumatic brain injury have difficulty understanding underlying intents. All of the areas of difficulty would be too much and too time-consuming for teachers to deal with on their own. They would not be able to give these children the individual time they require and deserve, so it is up to other professionals to work as a team with the teachers. If the child is receiving services from other professionals, they can also work with the child on the problem areas within their scope of practice, meaning they can only work on the areas they are specialized in. Since most of the duties of each professional will overlap, it provides the child with more opportunities to develop in the areas they are lacking. This hopefully will allow the child to be a successful student and a productive member of society. But remember that it all depends on the severity and the age at which the accident occurred.